Hi, I'm Dolly Vasta, and welcome back to Dolly's World. Do you have an animal that might be aging? You know they ache when they walk and worry about it because they're really a member of the family? Well, don't leave your seats today because I have the answer, or rather the answer is sitting next to me. And my guest today is Dr. Charles T. Skank. He's a wonderful veterinarian, and I'd like you all to meet him. Welcome to the show, Tom.
Thank you, Dolly, for having me this morning.
Well, it's fun, and we were carrying on a complete conversation before the cameras went on. But you have been a veterinarian for how many years?
Since 1958.
So,
48 years in May.
Yeah. And then you retired.
I did.
You sold your business.
I did.
And you were a veterinarian here in town, because I know when people are watching this, they're going to say, oh, I know him. What made you decide then to work in acupuncture?
Well, I started acupuncture very early in the game. There was only a very few of us. When I joined the International Veterinary Acupuncture Society, there were only 25 or 30 members, and that was in the 1970s. President Nixon had opened up China, and many acupuncturists got permission to come to the United States. When they arrived in California, the California veterinarians hired them to teach them acupuncture, and they formed this society. There were veterinarians interested in it in Europe, so it became an international society right away. And we could certainly see the benefits of using it. The horse industry was very interested in it because it's a monetary industry. You depend on that horse racing to win, and if he has a sore back, he's not going to come in first, second, or third.
I never heard of it done on horses.
Oh, it's a big part of the horse industry.
Really?
Yes, very much.
And yet, when you say that, I can understand it.
Yes. Yes, because you have trainers and exercisers and jockeys, and everybody's different in their riding style. They get up on the back of the horse and create a lot of problems for that horse. And so the response was very, very good in the industry to acupuncture. And that's why it filtered over to the pet practice right away. And because it was proven that it was safe, and it was proven that in the industry they accepted the fact that you could treat a horse before a race, but you had to give a quiet period. I think 24 or 48 hours, you're not allowed to treat it. I'm not a horseman, so I'm not sure the exact length of time.
Horsey terms, right?
But anyway, the whole program was proven to the satisfaction of the state boards that this was a okay thing to do. And it went on from there. I've been doing it. I was certified in 1986. So I've been doing it for more than 20 years, 20 years certified, and 4 or 5 that I was very active in it, but not certified.
Why did you decide, after giving up your practice and really the retirement age, and doctors are doctors, whether their patients are two-legged or four-legged, it's a rough business. And why did you decide to stay with this part of it, with the aging animal?
Well, probably
was it because you were getting older?
Yeah, that's true. And I was using acupuncture, having the benefits of acupuncture done to me. And but you know, I was in from the 1980s. Part of my practice, while I had a American Animal Hospital Association practice, I also had a sub-practice within the practice in which I was involved in alternative complementary medicine, holistic medicine, complementary medicine, whatever you want to call it. And so I was very interested in the healing aspects. Our regular medicine showed its deficiencies in that it's a pharmaceutical medicine, and that's not all the answers can you get from a bottle of pills. So I was very interested in the fact that I could place a needle in a pet and get a response that was satisfactory to the pet and actually can add 1 or 2 years to that pet's life. And we get this all the time. We have dogs brought in where the regular veterinarian says it's time, and
Yes.
the family is not ready to part, and I can help that pet for several years. So it depends, of course, on the age and the conditions and everything, but we are able to help at least 75% of them carry on in a much better manner, comfortably into old age. And comfortably means ability to get around, and your dog is an example. He came...
My dear Duffy.
Dear Duffy was in pretty dire straits, and while he's still, his condition requires him, or not requires, but his condition leaves him partially crippled in one leg. He's comfortable and happy, and certainly not in the need of euthanasia or anything at this point. He's much happier than he was when he came, I think.
Right, until he got to the studio this morning.
Studio
because yes, this studio absolutely terrifies him for some reason, and I think it's because there are no windows, and he has that thing. But we had such a good time doing it, though, and we're you know, Dave can cut away, and we did the whole procedure on him this morning, and he quieted down right away. So, Tom, where do we start?
Well, we're going to start right here on the front end of the dog. These points I'm going to use are points that have been proven to be beneficial to the patients over the years. And the Chinese have been doing this for 6,000 years. And the first thing you'll notice is that he doesn't mind the placement of the needles at all. You were surprised when he first had this visit to me in the beginning. You thought that he would be very upset by this, and most people do feel that way, but this is an excellent demonstration that needles placed in acupuncture points usually do not cause any discomfort.
Does the same go for humans, really?
The same goes for humans, with the exception that in humans, many times the points utilized are on the hands and feet or on the face. They use very fine needles for the face. The hands and feet, because they don't have a lot of muscle compared to the body and the legs, they can be a little more sensitive, but it is not a painful experience at all.
Well, I notice all the time you do this with your thumb. Do you measure out the between, like, the vertebrae?
I do, but what I do with my fingers also is a form of kinesiology, or muscle reflex testing, and that allows me to choose the points on the animal which are most beneficial to the patient, and it's the points actually that demand treatment, and this eliminates a lot of guesswork, and it makes for, I feel, a much better treatment program. You can see he's not...
No, he's not hyperventilating like he was
like
earlier.
He was. And he's calmed down, and he's quite relaxed.
Actually, he just told me he'd rather go home.
Well, he told you that before he came, but
That's right. That's right. He never wanted to
you didn't know
get
where
in the
you were
car.
tricking him into coming.
I know. Actually, it's funny, but I've told you this before, that when we say Dr. Tom to him, his head perks up, and if he's lying behind the bed, I say, come on, we're going to see Dr. Tom. He's out there.
Do you notice how nicely he he sets for this. You've had experience with this, but of course the viewers have not. But this is a very typical response where he calms down, and after the second or third visit, why, you know, each time he came, he became calmer and calmer about the whole treatment. I've forgotten exactly how many treatments we've done with him,
I don't know.
we started.
I think it's since March, May, April, May, somewhere around there.
But and this is all that there is to it. We allow these needles to remain in place for about 12 to 15 minutes, and there's no pain involved. In the initial treatment, you can expect results within 1 to 3 treatments. Almost all animals will show a change. And you know, the first change that you saw was a personality change.
Yes.
He felt better with the acupuncture results, and he felt better with this. And then, as he slowly came along,
Just
we'll
got a
take that one
needle
out of my leg. You're not supposed to let go, Dolly.
Sorry about that, Joe.
I've been trying to train you for weeks
I know.
to watch him.
I have news for you. It's easier to train the dog than it is me.
But it's a very pleasant experience for them, and many of my clients tell me that, as you did, their dogs are very happy when they realize they're going to come and have the treatment. So it's a nice way to wind up a career. I've been a long time in this business, and extending their lives for 1 to 2 years beyond what it normally would be has been a pleasure.
Well, you know, this can be applied, though, to an injured dog, right?
Yes.
Not just an older dog.
It can be applied to any age and almost any condition. Now, of course, it depends on the individual, the response of healing, but you know, it's accepted that 75 to 85% of the patients treated will respond to acupuncture. And I guess about 40% of my patients that watch their dogs undergo it go and have human acupuncturists treat them, because they see how much relief it gives the pet. The dog has no preconceived notions and does very well. The Chinese have been plotting these points and determining the method of treatment for acupuncture for 6,000 years. They were onto something. They really knew. And for people to close their minds to it is really a little bit on the backward side. There must be something to it. It's the only medicine that survived 6,000 years. Only earlier accounts were the use of lodestones or magnets in the very early part of recorded humanity. But acupuncture is something that is a viable method of treatment.
Now, I had some pictures here, and it's called, and I noticed it when I was in your office last week, of gold. It's called gold bead placement. What exactly is that?
Well, in situations where, for instance, it's inconvenient for a person to come to the office frequently, by frequent we should first start to say we treat an animal 5 to 10 times to see how he'll respond. And usually they're going to be responding by 2 to 4 times. And then when they get a response that we're happy with and the dog is comfortable or the cat is comfortable, then we will extend the period of time, and eventually, and we're dealing with older animals, so eventually they will hold their fix, so to speak, for about 4 to 6 weeks in a 12 to 14-year-old animal. So most of my older patients do come in once every 4 to 6 weeks when the course of treatment has been done. The gold beads are you insert 3 little gold beads under the skin over the acupuncture point, and they stimulate the point continuously 24 hours a day. So this is very effective in epilepsy, in hip dysplasia, where the situation is severe and you need to treat it for a long period of time. My own dog was a severe epileptic. After the gold bead placement, she went from severe frequent seizures to minor seizures 2 or 3 times a year, with seizures that just amounted to coming and sitting on your foot and shivering a little, and then it was over in 2 minutes. And so these stay there, they stay under the skin, and if you x-ray the dog later in life for some other reason, it looks like somebody shot it with very, very tiny bird shot.
Really? Well, I can see where you could be dragged off to jail for that. So that is done, the gold bead placement is done then when they're in, say, worse shape than Duff is right now, or?
Yes, yeah, Duff is at a stage, how old is Duff again?
Well, he'll be 16 in May.
He's 16. We don't want to put Duff through any anesthesia, and we've already started to stretch his treatment program out, so it's better not to do it, although it can be done. Dr. Durkees, who was the pioneer in this treatment, has done 17 and 18-year-old dogs with this. I like to do them a little younger than that, but it could be done in the right conditions.
Very good, very good. When you were talking about holistic medicine before, do you feel that holistic and regular medicines, dog medicines, I'm trying to think of the word for it, scientific compounds, okay, work well together, or you can't mix them?
Oh, you can work well together with them. There's no, you know, the art of healing should be that you look at all the tools that are available and select for the individual patient the tool that fits the patient. And so your dog, rather than use pharmaceuticals and use a lot of cortisone on him that is going to cause urination and other problems, weakening of the whole system, instead of that, it works much better to have acupuncture, which you can see there's no after effects. He feels good when he goes home, and he's does well. And so therefore, to me, that should be the way to go.
Well, a lot of regular doctors now are doing both.
Yes, they are. Because, why? It takes the regular medical profession. There's a joke in the profession, but it's not a joke, it's the truth. It takes the profession, whether it's human medicine or veterinary medicine, it normally takes them 20 years to get the message that there's something better out there. The professions are very, very slow to adapt to new things. 20 years ago, acupuncture was really looked down on. 25 when I started it. I was the second person in the state to use it on animals. And it was really looked down on, and they thought that it was really nuts. And, but 25 years later, it's respectable enough now that you can find MDs in the community that are certified to use it, and you find many, many acupuncturists in practice now.
And you also find regular MDs and specialists recommending it. I know my neurosurgeon said he has a theory, whatever works.
That's right. That's right. And that's the way it should be.
Yes, it should. Now, you mentioned before there were other forms of acupuncture. What are they?
Okay, needle. The needle is a primary form.
Right.
But you can, and we've spoken about gold bead placement in acupuncture points. We can also inject vitamins into acupuncture points. Homeopathic materials into acupuncture points. And I also use electroacupuncture as I have on your dog.
And he responded so well.
That's a little stronger kind of a treatment, and it involves putting a very small current through the needles. And this is not painful to them at all. As you know, he takes it just fine. And they also use laser. And that's about it. That about covers it.
Do you do all of them?
Yes, I use variations, and especially
Or combinations?
combinations. Yes. It's if one thing doesn't work, you have something else to try as a backup, and for that individual. And so it's a very nice, and they're all equally non-traumatic for the patient.
In other words, you really have to suit the treatment to the patient, because not all patients respond to just one thing.
That's correct.
So it's individualized.
It's individualized, right? Very much so.
Which is good, rather than getting the standard, well, take 2 pills and let me know next week how they're doing.
Well, I always start with the needles, because there's a feeling and a bond there that this is where I am comfortable to start with. But I use whatever that patient needs.
You seem so happy and satisfied doing this, as as a part of or continuation, really, of your medical life.
Oh, absolutely. I'm still in that medical life.
Yeah.
And I'm still contributing to the welfare and the benefit of the patients. And it's nice, because my patients like to come in and see me.
That's right. I know when we say today, and it's the funniest thing, and I tell you this every week because it amazes me, your office at the moment is in Belmead. And the name of the clinic is Harlinger, right?
Harlingen.
Harlingen
Veterinary
I always say
Clinic.
it wrong. But it's a little ride, but you have to hit 206. And he seems to know, Duff seems to know, the minute we get on 206 and we turn on that light, he sits up, and it's amazing. There is a total transformation in him. And the first time it happened, I said, there's a, I don't know. But it's every time we come.
Yep.
And we laugh at it, so.
Yes. Well, it's the only part of my years in practice that 95% of the patients are really happy to get there. They understand that they get a fix from this. And there's a lot of reasons, but the basic thing is it causes them to feel better, and they understand this.
Well, there's always been a big discussion, too, on how much do dogs sense? How much do they understand?
They understand a lot. They really do. Yeah. We don't understand enough. They understand more than we do.
Which has always been my theory, that they're a lot brighter than we are. If there's anything that you could say to the audience watching you concerning their animals, be they dogs, cats, hamsters, whatever, what would be the best piece of advice that you could give them as a parting shot, so to speak?
Well, just keep an open mind on treatments and not be limited. Keep an open mind in everyday life. There's no one set of rules and regulations that applies to all. And you have to be open. Acupuncture's been criticized because it couldn't be proved. It's been proved for 6,000 years. It's proved every time a dog responds that has no preconceived notion of whether he's supposed to improve or not. He could care less when he comes in the first time.
Right.
And he comes to realize that he feels better. So we should not be so closed-minded. Pharmaceutical medicine is fine. It has a place. Surgery is fine. It has a place. Acupuncture has a place. Homeopathy has a place. We need to have complementary attitudes toward things, and we proceed a lot further.
Get rid of the tunnel vision.
Get rid of the tunnel vision. Absolutely.
Tom, it has been such a joy having you here. It really has. I've had so much fun, and I could go on and on and on with you on the other topic of animal research. But I just wish you all the luck in the world.
Well, thanks, Dolly.
It's been a privilege knowing you, and it's really, it has, and of bringing Duff up to you, and I see how he feels about you, and Duff cannot be wrong.
Thanks.
And with that, I hope all of you out there enjoyed the show. I know I enjoyed it. I always enjoy discussing animals and how to take care of them and the environment that they live in. I'll see you all next month, and in the meantime, take care.